This is an environment where it's very enriching, it's very exciting, it's intellectual, but at the same place, there's a lot of fun here.
It's such a great city full of such vibrant people.
There's the opera, there's theater downtown on Broadway. There are parks, there are festivals.
I'm a foodie, so living in the city is a blessing. There's food market, there's all these upcoming restaurants.
There's no place like New York, and going to school here in New York has been a great experience.
It's a very vibrant and interesting city. It's different than any place, I think, in the world, and I think that attracts our faculty, our staff, and certainly our students.
All of our students have baccalaureate or master's or doctoral degrees in another subject and have decided to change their career to nursing.
Before becoming a nurse, I was an opera singer. I sang for 20 years. I wanted to become a nurse because I had a friend who died of cancer, and I was exposed to the hospital environment, and I saw how the nurses cared for him and his parents, and how they were there to support him, and they showed the compassion, and that really drew me in.
You can come here as a career change person, and you can enter our Master's Direct Entry program, and in 15 months, you sit for your boards and you become a registered nurse.
I went to UC Berkeley for my undergraduate degree. I was studying bioengineering with the plan of going into the medical field. And I realized after doing some more research that nurse practitioners provided the exact type of care that I wanted to provide.
I'm involved in a camp for kids with diabetes. I saw these children managing their diabetes and the education they needed to conquer their diabetes, and I wanted to be a bigger role in their lifestyle.
I knew that if I wanted to be able to make a difference and impact the world around me, I needed to become not just a nurse, but a Columbia nurse.
Our faculty and staff are really exquisite. That makes Columbia great.
I find the faculty at Columbia Nursing to be leaders, inspiring leaders.
We have our own faculty practice, which means that our students see our clinicians, our faculty practice. They can have opportunities to engage in those clinical environments.
As a Columbia nursing student, and now as a nurse practitioner student, I've been volunteering at an adolescent clinic for 13 to 24-year-old homeless LGBT youth.
The students have great clinical placements, and the kinds of individuals and families that they care for I think, gives them a really good understanding of the health challenges in the U.S. that they're going to be dealing with wherever they go when they leave us.
The students really experience some city hospitals, some state hospitals, some New York Presbyterian hospitals, and we are currently using simulation really to give students an opportunity to try a procedure on a simulation mannequin prior to doing that on a real patient. We're looking very forward to our new simulation center, which will be 2 floors in our new building, which will be a very high fidelity simulation. We can do all kinds of patient scenarios.
I was in an ER this past semester, and I had patients from all over the world. Patients that arrived 2 or 3 days before seeing me to the US looking for great health care, and I was able to deliver it to them.
This year, 24 students went to clinical sites in other countries. This is fairly unique. I do not know of any other nursing schools that actually offer hands-on 6 weeks being immersed in a different society, a different culture, and different health practices. We had students go to Malawi, we had students go to Ghana, we had students go to Spain, we had students in Ciudad Juarez in Mexico, students in La Clínica de la Familia in the Dominican Republic, and in Jamaica, University of West Indies. At Columbia School of Nursing, we promote highest level of knowledge, clinical practice, education.
I went on a medical mission trip to Honduras, and it was there that I witnessed a nurse practitioner, and she was giving them care and educating them and treating them in such a way that it just spoke to me. And it was in that moment that I kind of knew that that was something that I could do for the rest of my life.
Advanced practice nursing is the pillar of what we do in educating nurses here. It allows us to engage with nursing leaders around the globe to look at advanced practice nursing as the next step, the necessary step towards achieving universal health coverage.
I decided to come to Columbia Nursing because I knew that Columbia Nursing would allow me to make a difference.
If I were to describe my experience at Columbia Nursing in one word, it would be empowering.